Andrea Payne, and I am the program lead for the Middletown Nursing Program. My background is critical care, cardiac, and I did float pool. I've also done leadership, such as director of critical care, and then worked within the hospital systems with education.
I'm Mary Katz. I am a full-time faculty member here at Laurel Ridge in the RN program. I am actually the program lead as well for the Fauquier campus. I've been a nurse for 30 plus years. I myself am a community college graduate. Had I not taken the community college route in the very beginning, I would not have been able to afford to go to college.
Nurses, you are basically the caretaker for the patient. You're the voice of the patient. You're the advocate for the patient. You are the one that's giving the medications. You're doing the interventions that is being ordered by the physician.
Laurel Ridge is an associate's program in nursing for the state of Virginia, and you can sit for the license to become a registered nurse with just a 2-year degree. We're technically a 4-semester program for the RN program. It usually takes a little bit more than that because there are at least a semester of prereqs. Once you're actually into the nursing program, we have 4 semesters that are pretty intense. All of our classroom right now, teaching is in person, so that's classroom seat time. And then from the very beginning, you are also in clinical at least 1 or 2 days a week.
And not to scare anybody, but nursing is rated the #1 hardest program. So I think that having that expectation set up front is really important. Having the expectation from not only yourself, but your family members is important because they're going to really need to help support you at home and give you that time to study. You're going to expect not only to have classroom courses, but you have the state of Virginia requires a minimum of 500 hours in clinical during this program. In order to sit for boards, you're going to have examinations, lectures, simulations. They might be virtual, most are in person. Expect in clinicals to have one-on-one patient care, and as you go through the program, your competency is going to increase. Up to and including in your 4th semester, there's a preceptorship where you actually are going to be working with the nurse one-on-one. You get to work their schedule, you get to walk in their shoes. Then in order to actually become a nurse, you do have to sit for a state license, the NCLEX exam, before you would be granted a license in order to be a nurse. Right around the COVID peak, the incentives were great for hourly wages and ranges. There was a lot of incentive to come in and work extra. You can expect to negotiate some higher salaries, and you can negotiate some higher incentives for sign-on bonuses and/or student loan payback programs are available as well.
I mean, the average salary in our area for a bedside nurse is about $75,000 a year, and that's a really good number for a 2-year degree. With automatic admission in the state college system for Virginia, you can go in and get your bachelor's, and bachelor's, master's, doctorate degrees, they're all required for any kind of advanced practice nursing.
I think that it would be a good idea to refresh yourself on math. There's a lot of math involved in the program, and I don't think people really realize how much it is. I really think that getting yourself at home, settled, making sure your family understands the commitment, making sure that you set time for yourself to study uninterrupted is real important. You're not going to be able to take care of others if you're not healthy yourself, both mentally and physically.
We really, really need nurses as a society. We've heard nursing shortages forever, and they've been there. The pandemic increased that dramatically. We really, really need good nurses.